Hi, welcome to my channel. My name is Nurse Terry, and today our topic is pregnancy week by week, and we'll be starting with the first trimester, that is week 1 all the way to week 12. So watch till the end so that you may not miss any single step.
It doesn't grow, give up, let it go.
Again, ladies, and we're going to start with week 1, and you should know that your 40-week pregnancy countdown begins now. That is from week 1, and actually from week 1 and week 2 all the way to week 3, you're not actually pregnant, or you're technically not pregnant, but it's an important time for preparation. So during this week, you are mostly likely to get the symptoms of those symptoms that you usually get just before your period arrives, and those are bloating, cramping, fatigue, breast tenderness, headaches, food cravings, and moodiness. So what are some of the self-care tips? And during week 1, you should start the preconception vitamins such as the folate, that is the vitamin B9, and do not drink or use drugs, and prepare physically for pregnancy. Week 2 is the ovulation week, and this week you should time sex wisely so that you can conceive. And once fertilized, your egg will now be called a zygote. Make sure you watch this video that I did previously, that I was talking about baby development from week 1 to week 40, and you will learn so much from that video. Week 2 symptoms are mostly the ovulation signs and symptoms, and these are cervical mucus will begin to thin out. You'll have a great mood. There's an increase in sex drive. You will glow more, and the ovulation pain. For week 3, it's the implantation week. This week you may notice your very first pregnancy symptoms, and your common symptoms this week are mostly the emotional ones, such as you feeling more nervous and more anxious, because this is the waiting week, and you're most likely to get some spotting. Week 4, you are already pregnant. You can now get a positive pregnancy test this week, and it is actually the time to schedule your first prenatal appointment. So week 4 checklist: you should eat well, exercise, get some rest, purchase a home pregnancy test, and continue taking prenatal vitamins. Week 5, you are probably feeling more tired than usual. You may also notice some uterine cramping, which is normal, and the high HCG levels can now cause more early pregnancy symptoms. And the common symptoms this week include a missed period, breast changes, that is they will be tender to touch, they may seem larger than usual, and the fatigue, morning sickness that could include nausea and vomiting, extra bathroom trips, that is frequent urination, and a range of emotions. Sometimes you're sad, sometimes. For week 5, continue taking prenatal, be active, make safe food choices, visit the dentist because of the gum changes that occurs during pregnancy, avoid pregnancy dangers, that is, do not take over-the-counter medications, do not smoke, take alcohol or any recreational drugs, do not engage in harmful activities. Week 6, the common symptoms for week 6 include fatigue, morning sickness, and frequent urination. So what are some of the things that you need to do? Continue taking prenatals, get some extra rest, stay hydrated, 10 to 12 glasses of stay hydrated, that is, take 10 to 12 glasses of water. Be prepared to combat nausea. Start a pregnancy journal or a notebook, and start your prenatal visits. Start your prenatal visits if you haven't already. Week 7, your baby's heartbeat can be felt on an ultrasound, and you may have that pregnancy glow. Week 8, your uterus is about the size of a grapefruit, and abdominal cramps are normal at this point, and the baby now has all the organs. Some of the symptoms that you may experience include dizziness, cramping, lightheadedness, feeling cold, clammy, and nauseated. Week 9, warning: the mood swings are real and they may peak this week. So to-do list: get a cup-sized bigger bra, and you may tend to have sore or itchy breasts, which is a common phenomenon. 10. Dreams may be more vivid and more strange, and you may notice a dip in blood pressure and blood sugar as your body is producing more blood for the baby. These two can bring about more daytime sleepiness, so you may feel more sleepy during the daytime. Week 11. If this isn't your first pregnancy, you might start to show, and your hair may start to change the texture and grow faster. Nails may also become stronger and more beautiful, just like the hair. Week 12. Nausea and vomiting may ease, and your regular clothes are probably feeling a little bit tighter than usual. Some of the common symptoms that you should expect this week include clothes are not fitting well, and relief from symptoms such as nausea and vomiting and frequent urination. 50% of women will notice some change in their skin pigmentation, and this is called the pregnancy mask, and this will last until the end of the pregnancy. So we are done with the first trimester of pregnancy. That is everything that will happen during the first trimester, and that is everything that you should expect. So make sure you watch the second set, which is the second trimester from week 13 all the way to week 28, what to expect and everything that goes on there.